In the science of anatomy and physiology, we use a lot of very precise language, new language for most of us. This language is critical because it helps us describe not only individual structures, but the location of those structures in combination relative to each other. It helps us describe particular views of the body in planes of division, and it also helps us describe various cavities within the body. Anatomical language is hard to learn. Remember, about 90% of medical terminology comes from Greek and Latin, and these terms are difficult, especially if you're not a strong speller. It's important to spend enough time as you study to learn this terminology and be able to recall it quickly. Anatomical and physiologic terminology allows scientists to talk to each other in a meaningful way about all of the different structures and functions of the body. In anatomy and physiology, we always describe things in relation to what we call anatomical position. So when we're describing a structure in relation to another structure in the body, when we're using this directional terminology, we always assume that the body that we're discussing is standing in a particular way. That way is shown in this image over on the right side of the slide. We imagine that the subject is standing erect, facing us, the observer. Their head is level, their eyes are facing forward. The feet are flat on the floor and directed forward. The arms are down at the side, and very importantly, the palms are turned forward toward the observer. This is what we refer to as anatomical position, and this allows us to use anatomic directional terminology. You can see some of that terminology in the diagram. Not only common terms like right and left, but also terms like proximal and distal, superior and inferior. Many of these directional terms come in pairs. For example, those terms superior and inferior belong together. The term superior describes a structure that is closer to or more toward the head or the upper part of some structure, while inferior describes something that is further away from the head or toward the lower part of the structure. Now you'll notice I have a second set of terms in parentheses next to the first. The term cranial is synonymous with the term superior, and the term caudal is synonymous with the term inferior. In human medicine, we tend to use superior and inferior. In veterinary medicine, we tend to use cranial and caudal. But you should know both sets of terms. Now, over here on the right, you can see a diagram of a person standing upright. If I was going to describe, let's say, a laceration right around this location on this person's arm, I could say that that laceration is superior to the elbow. I could say that it is inferior to the shoulder. Anterior and posterior are another pair of anatomical terms, and you'll notice that the terms ventral and dorsal are synonymous. Anterior refers to nearer to or at the front of the body, while posterior refers to nearer to or at the back of the body. In the diagram, you can see the skeleton here facing off to the left side. Structures that are towards the front of the body are described as anterior. Structures towards the back are considered posterior. And again, ventral is analogous to anterior. Dorsal is analogous to posterior. Medial and lateral are directional terms that refer to the midline of the body. So you have to imagine that there's a line going through the exact center of the body. Anything that is toward that midline is referred to as medial. Anything that is away from that midline is referred to as lateral. Proximal and distal refer to structures that are located on the limbs. Proximal describes nearer to the attachment of the limb to the trunk. Another way to think of that is nearer to the point of origin of a muscle, for example. Distal refers to a structure being farther away from the attachment of the limb to the trunk, or farther away from the point of origin. For example, the wrist is distal to the elbow. The shoulder is proximal to the wrist. Notice that the skeleton is standing in anatomical position. The palms are facing forward. In addition to directional terminology, we also use a lot of very specific terminology to describe planes or sections through the body. The sagittal plane, for example, is the vertical plane that divides the body, or any structure in the body, into right and left halves. This is one of the most commonly used plane in the body. Now, there are also related terms of mid-sagittal and parasagittal. In the diagram, you can see that this piece of plastic or glass has come down through the body vertically, producing right and left halves. If this square of material were exactly down through the center of the body and we produced equal right and left halves, we would describe this plane as mid-sagittal. In comparison, if the plane were to move slightly more to the right or to move slightly more to the left, producing unequal right and left halves, that would be referred to as a parasagittal plane. The frontal plane is the plane that divides the body, or some structure in the body, into anterior and posterior portions. In some source material, you'll also read the frontal plane described as the coronal plane. In my experience, frontal plane is the more commonly used term. The transverse plane is the plane that divides the body, or some structure in the body, into superior and inferior portions. Remember, superior means towards the head, inferior means away from the head. A transverse plane runs horizontally and cuts the body into those halves. On this slide, you're looking at a depiction of all three of those planes together. You can see the sagittal plane here, again dividing into left and right halves. Remember, mid-sagittal is the plane that divides the body into equal right and left halves. We can also see the frontal or coronal plane dividing the body into anterior and posterior portions. And here's the transverse plane, the horizontal plane, which divides the body into superior and inferior portions.